Hi, my name's Phil. I'm a psychotherapeutic counsellor and a trauma therapist. And today I'm going to talk a little bit about how we might be managing via obsessive compulsive behaviours feelings that might actually relate more to historical trauma or cPTSD. So, feelings we might have dissociated from. So, when we dissociate, what we're doing is sort of severing the memories from the feelings. So if we can't think about them, we can't be hurt by them. Now, so that doesn't mean that those feelings aren't still in our body. It just means that we're not in touch with them. So it takes a lot of energy to keep all of that stuff buried. So when we get tired in the present, burnt out, ill, or something happens that just knocks a bit of the wind out of our sails, it might be that the energy that manages all of that dissociation might not have the capacity to do a good enough job, which means that some of those old feelings might start coming into our process. And if that happens, our brain's going to need to find ways to manage them. So this means that when those old feelings start setting off alarm bells within us, dissociation is going to stop us from knowing what the threat is or why we're suddenly more anxious. So, to manage the increase in hypervigilance and make sense of that fear, our process might find something in the present or in the environment to blame for those feelings, something to be scared of. And if we do that, then we can react to that thing as though that is the actual problem. And one of the ways that we might then manage our anxiety around this would be by developing and implementing obsessive compulsive rituals or strategies just to manage that. So the first thing we need to consider is that just because you might have some traits and behaviors typical to OCD, that doesn't necessarily mean that you have an obsessive compulsive disorder. Although there is, of course, a possibility that you might have. We just don't want to be adding a disorder title to ourselves if we haven't had that properly checked out, because that can create mental health issues within itself. There is research that states that OCD can have a genetic element, so it would figure that people with that genetic element would more than likely go to obsessive compulsive behaviors as a default way of coping with trauma. But others who do not have OCD in their makeup, they might also still develop traits of that personality style as a means of managing their trauma. So in effect, there are many reasons why people might be driven to perform obsessive behaviors or rituals. But today we're just going to be focused on how trauma might factor into all of this. So when I say trauma or historical trauma, I'm meaning anything that might have resulted in you experiencing significant levels of negative emotions. So this could be as a result of being involved in or witnessing a traumatic event, spending too long in a negative or dangerous environment, like children would if they were neglected, abused, or the environment really wasn't suitable for meeting their needs. Because it doesn't take much to traumatize a child. But adults can also develop cPTSD or trauma symptoms in the same way. Paramedics, for example, fire brigade personnel, police, military, nurses, doctors, even counsellors, or any member of any profession, or anyone who spends a lot of time dealing with disturbing situations or dealing with people who've had a lot of disturbing situations, because it's very easy to be vicariously traumatized by other people who are traumatized and start taking on board their symptomology. So, in relation to OCD and trauma, we need to be imagining the obsessive compulsive behaviors as being an anxiety management tool that assists us to counter our historical trauma. And it does this by the use of two defensive strategies, which I briefly mentioned earlier. And these are known as dissociation and projection. There will be other factors, of course, involved in the management of trauma, of course, but to simplify a complex process, I'm just going to discuss these two defenses today. So, in relation to dissociation, that would be the way that our brain, at an unconscious level, keeps us separate from our historical trauma. So, many people I've worked with in therapy do seem to have an awareness of this process, and they often call it their box or their trauma box and say that they put everything in there that they don't want to deal with. So, some people do seem to have the capacity to dissociate or block stuff off with conscious effort. But often dissociation is a purely unconscious defense that we have no control over, because it's the brain's way of survival. If it doesn't want to deal with tremendous stress in that moment, it will just shut it off. It'll find a way to box it off. So this boxing off of our feelings is useful, because if we didn't have the capacity to dissociate, we would be stuck feeling all of this stuff all of the time, and that's not going to be good for us. And if we also think of logically how our brain functions at a biological level, we know that it unconsciously reacts to trauma by acting in ways that better enable us to survive. So detaching from feelings and memories that might slow us down or hamper our survival, that's going to work. It's going to do that. But for some, dissociation just isn't going to be enough to prevent those old feelings from seeping back into their minds and bodies once the lids come off that trauma box. And at this point, the unconscious might then use projection to better manage these feelings and give us new ways to deal with the feelings that we don't want to acknowledge. So projection in this case would mean that we project or expel a level of fear that is relevant to that which we're detaching from out of our body and onto something or someone in the environment, something local, which we then believe is the thing that is truly worrying us. So in effect, we've identified with our own fear that we have projected out. And we've created a phobia that we can now avoid or manage in some way to manage our anxiety. So it's quite a clever way of externalizing our fear, if you think of it logically. So now we are feeling that the fear from the original trauma is about cats or home security or bacteria, or that partner is going to abandon us, or that it's not safe to go outside, or that we need to hoard or collect stuff because it's going to be really important that we need these things later. So in effect, that fear could be getting projected onto almost anything. And if projections rather than logical thinking's running the show, then there's no limits to what we could be imagining we need to do to stay safe. So when we think about the scale of our reaction to something, we need to consider how that relates to our historical experience. So if we take, for example, someone with cPTSD, their level of anxiety is going to have been influenced by an event that was life-threatening. So their reaction is going to be through the roof. So the levels of behaviors that they're going to have to perform to manage their anxiety is going to be consistently relevant to that experience, which means they're going to be forever in a hypervigilant state, always feeling like they're in danger. Sometimes the obsessive compulsive behavior could be inviting extreme avoidance measures as well, though, because if we can avoid something, we can avoid it, then that will make the sufferer believe that something can't happen to them. If I can avoid it, then something isn't going to happen. I stay alive. So an example of how this might sort of happen within our process could be that if we think of a child that was attacked as a very young child and believed that they were going to be killed, that fear of being killed might be being projected onto bacteria or viruses in adulthood. So in effect, their reaction to the projected bacterial threat in the present is appropriately relevant to the belief that they could have died in the past. So we're not saying here, of course, that viruses and bacteria are not dangerous to life. Of course they can be. But we also know for a fact that not all of them are, or we wouldn't survive a day in the world. We'd all be killed day one. Well, they wouldn't be here. It would be the old chicken and egg thing, but both would be wiped out by the virus. So sadly, the traumatized brain, though, it doesn't have the capacity to be so rational about such things. It will err on the side of the caution that the bacteria is deadly because it's needing to believe that this is about bacteria and not that I was nearly killed as a child by my parents. So once projection has been utilized and something else has become the focus of our fear, the externalized fear can then be managed by performing an obsessive compulsive action or ritual or avoidance that stops us feeling it for a while. And of course, that reduces the anxiety in our body. So to simplify this chain of events, the first link of the chain would be that for some reason, the historical trauma that we're holding in our body, but dissociated from, starts to be experienced again as anxiety. The second link would be that because our means of dissociating from the anxiety is no longer working, our brain then needs to find another way to detach from that anxiety, as it does not believe that it could cope with re-experiencing that historical trauma. So at that point, the fear is externalized via projection. So an external fear of something is created that we can then fix upon as being the cause of our anxiety. So the third and final link would be that we would then develop an obsessive compulsive strategy or avoidance action to manage that phobia. Because as long as we're focusing on that thing in the present, then we're not having to acknowledge the split off feelings of terror from the past. So if our obsessive behavior relates to counting the tiles on a wall, not stepping on cracks in the pavement, or the need to touch things in a certain way or order, then the same things occurring. The ritual of counting or stepping or avoiding is helping your process to detach from what it does not want to feel, from what it doesn't want to think about. So if you think about it, in reality, by maintaining this way of being, by maintaining this strategy, our life isn't naturally going to get any easier for it, isn't going to get better, because we simply aren't dealing with soothing or releasing the historical trauma that we're holding in our bodies that's causing all this in the first place. We're just managing and soothing that fear by proxy of doing something somewhere else. So in effect, it doesn't matter how many times you check the car door or clean your hands or avoid the cracks or return to work to see if you've hurt someone by accident. The fear isn't going to be reasoned with, as you're not dealing with the true reason why you're anxious. We also need to be mindful that because of dissociation, you may not even be aware that you were historically traumatized. And of course, that complicates the process a lot further. But how I'm going to describe we manage this might still be useful in that situation. So also, if you're using obsessive compulsive behavior to manage trauma that is overwhelming you in the present, say in relation to your work role or your living situation, once again, that situation is unlikely to improve until you start processing what it is that's actually driving your behaviors away from that situation. Because how you might be managing that anxiety might be just a distraction that's going to possibly burn you out in the long run or cause problems at home. Because if you're getting obsessional about things at home so you don't have to think about things at work, that's going to have a big price on your social life, you know? So changing these patterns of behavior isn't going to be easy either. Not for anyone. Nobody changes this easy. So it's important you don't go to shame if you struggle with this, because nobody has an easy time changing these sorts of defenses, you know? Because when you think about it, this way of managing your fear is likely the only way you know how to do that. But if we can get better at recognizing how our history might be impacting our choices in the present, then we might be in a better place to bring rational thinking on board when the impulsive need within us triggers us into action to do whatever task it is that we need to preoccupy ourselves to keep, those feelings from our past at bay. So how do we raise awareness and develop the capacity to recognize that the phobia that we are managing is not as dangerous as we believe, or that the action that we're taking to counter that fear is not as important as we feel it is? Well, that's the tough bit, because your trauma brain is not going to want to stop using strategies that it is finding useful to manage the feelings in its system. It's not going to want to do it a different way at first. So there is going to be resistance from your process. So change isn't something that's going to happen overnight, but the people who do make good progress in changing or reducing their obsessive compulsive behaviors tend to be more successful because they take their time with it. They learn to get a better understanding of what their process is up to, who they are, and over time build up the internal resources to better manage the compulsions. If you try to make too many changes too quickly, you're likely to encounter levels of historical emotions that you're just not going to have any means of managing. And this is because your obsessive compulsive behaviors, like we said, are the only way that you know how to deal with this stuff. So going cold turkey with the behaviors is not the best idea. So, in effect, over time, we need to get better at challenging how logical our responses are to feelings and situations, which means that we need to keep ourselves in an analyzing frame of mind as much as we can, because when we're thinking logically, we're less likely to be acting irrationally, which is what a lot of obsessive compulsive behaviors are, irrational. So the statement, when we are thinking logically, we're less likely to be acting irrationally, needs to be written and stuck on the fridge, put in your phone, just so we can keep reminding ourselves to practice thinking rationally, which is of course the opposite of what the obsessive compulsions will have you doing. So that defense strategy is going to be running the show at the moment, and it's not going to want you to think logically. So you're going to need to find ways to hook into that sort of adult way of thinking, that analyzing way of thinking. So when we do start challenging the validity of the projections and we get better at not doing something to counter the fear, then we're going to start to feel something in the void that doing nothing creates, the void that we've been avoiding all along by doing. And this is where entering therapy or talking to good friends about your feelings rather than distracting yourself from them with an obsessive behavior might help. Because a lot of this is about being in that void where we haven't got a strategy to manage our feelings in that place. What we're saying we need to do to help move forward is totally the opposite, is actually to feel those feelings that come up in the void when we're not doing the strategy, and actually be okay with those feelings, recognize what they're there for, that they might not be dangerous, they might not be necessary. We just need to get better at sort of having that understanding. But if we're avoiding going into that void because we're doing the obsessional behavior, then we're going to keep cycling that. So we need to remember that the dissociated feelings that are driving all these behaviors are feelings about something that has already happened to you in the past. So if over time you can understand, accept, and get better at managing your historical trauma, like I said before, if you can remember it, you might develop a better capacity to self-regulate by internal means rather than by having to use external behaviors. And this will simply be because you'll be approaching situations in a more logical state of mind rather than being in a traumatized state of mind, which is, of course, often illogical in how it's perceiving the situation in the present. So, if you can get good at growing the ability to analyze these dangerous or stressful situations more rationally, then you're more likely to be able to regulate your reactions when these situations occur. And that might give you another way to react to them. It might just give you choices in that moment. And even if you can just reduce some of this stuff, even just by a tiny bit each day, over a period of time, it helps, it matters. So, you'll have good and bad days when you're trying to manage this, when the historical trauma will try to, reignite itself in your process. It'll try to sabotage your progress in this. But it's important we don't give up. We keep trying. We just, in little bits, in little ways, we just try to react a little bit less each day or each time. And we just make ourselves a habit of logically thinking a little bit more like that. So hopefully this was useful for you. OCD is a complex subject, and this was just a tiny bit of one area of it. But in general, if you're thinking more about it, thinking more about how the OCD process might be, or your obsessive compulsions are driving you, then you're accessing the more logical part of your brain, and that's always a good place to be when you're dealing with strong emotions. So thanks for watching, and I'll pop another one of these videos on soon. And if there are other areas of psychotherapy or this sort of stuff you want me to talk more deeply about, just drop us a line in the comments and I'll see if I can do your video. Okay, take care. Goodbye.